Do anybody know the signs and symptoms of a heart attack?
Chest pain, nausea, dizziness.
Could even have jaw pain or shoulder pain, depending on the person.
Okay. Of course, clutching of the chest when a person is having a heart attack, they're going to be clutching their chest. Pain and discomfort in the jaw. Pain radiating in the left arm, because your heart is a little bit located a little bit towards the left side. Of course, chest pain, nausea, vomiting, extreme exhaustion. Women's signs and symptoms are a little bit more severe than men. But you want to call 911, and if they're conscious and if they're able to swallow, you can give them an aspirin. Do anybody know the signs and symptoms of a stroke?
Slurred, like use the FAST acronym, so slurred speech, drooping face.
Mm-hmm.
You can do the arm thing if it comes back down.
Okay, yes, the acronym called FAST. The F is for facial weakness and drooping on either side. The arms, if they're able to raise their arms, one or both arms, or one is higher than the other. Slurred speech, you can ask them to speak a simple sentence like I love you or the sky is blue. T is also for time. And it's another one, kind of a new symptom, the tongue. If they're able to stick out their tongue, but it's like leaning toward either side, that's a sign. And T is also for time, because time is very crucial when a person is having a stroke. The sooner that somebody can recognize the signs and symptoms and can get them to the hospital as soon as possible, they'll have a greater chance of surviving. And the doctors can kind of reverse the signs and symptoms of a stroke. A person can also have a sudden severe headache, confusion, difficulty seeing, swallowing, and walking. They'll have weakness and numbness on either side. And it can also result in paralysis and even death, especially if they don't get treated and get to the hospital in time. Okay, what about shock?
You lay them flat on the floor with a blanket and monitor them.
Mm-hmm. Okay, what about the signs and symptoms?
They might be pale or flush, like sweating.
Okay, they'll have pale, cool, moist skin. They'll be confused. They are pretty much unresponsive. They'll have this like stare, not really a death stare, but a stare.
Spaced out.
Yeah. They'll feel restless. They'll have a drop in blood sugar. They'll feel irritable. You'll notice a blue tinge to their lips and their fingernails. They'll have a rapid pulse, rapid breathing, and they'll usually be extremely thirsty. They'll have extreme dry mouth. You want to call 911. If they're hot, you want to keep them cool, move them to a cool place. If they're extremely cold, you want to keep them warm and have them to lie flat. It's pretty much caused by different things, infections, any type of illness, trauma, allergic reactions, and dehydrations. There are a few different types of shock. I'll go over a few of them. One is cardiogenic shock. That affects the heart muscles, and it can cause damage to the heart and the heart muscles. Anaphylactic shock, that's severe allergic reaction. I'll talk about that in a few minutes. Septic shock, that's a very deadly form of shock. It's pretty much blood poisoning, where infections and bacteria can get in your bloodstream. It can cause major damage to your organs, and you can actually die from that. People with septic shock, they mostly get it from different things, mostly the hospitals. Maybe hospital-acquired infections. You can get bad infections from cancer patients can get bad infections from their chemo ports. Dialysis patients can get bad infections as well from their dialysis ports. So like I said, it's a very deadly form of infection, and you can die from that. It's very deadly. Neurogenic shock, those are spinal cord injury patients mostly get this. It mostly affects this nervous system, the central nervous system. And hypovolemic shock, that's pretty much dehydration. You're losing a lot of fluids and not enough blood is going into the vessels. People that like are extremely hot all the time, people with heat exhaustion, and even burn victims, people that have burns all over their bodies, they're at risk for hypovolemic shock because they've lost a lot of their fluids. Okay, any questions on that? Allergies. Skin allergies, people break out into hives. They're itching, they're flushing, they have red watery eyes and stuffy nose. Severe allergic reaction, that's anaphylaxis or anaphylactic shock. It's very life-threatening. You'll notice swelling of the face, the tongue, the lips, shortness of breath. We have the EpiPen here. You all seen the EpiPen? Let's remove this. This one is broken. But most people use the upper arm, but it's better to use the upper thigh. This is supposed to click. Hold it for a few seconds and remove it. There are a lot of different common allergies. Nuts, a lot of different types of food. Nuts, eggs, seafood, dairy products. Any insect bites. Gloves, powdered latex gloves. A lot of medications, especially antibiotics, can cause allergic reactions. Certain cleaning products, anything with latex in it, colognes, perfumes, scented body washes and lotions, even animals. A lot of people are allergic to animals. There are some over-the-counter medications that are good for allergies. Claritin, Zyrtec, and Benadryl. Those are good for allergies. Okay.